So going through the surgery itself now, I would say most surgeons perform this under local anaesthetic as a day case, but different surgeons will have different preferences. My preference is that my patients come to the hospital, they will get an injection of local anaesthetic in and around this area about 30 to 40 minutes before the surgery. And that means two things when they come down for their surgery. Number one, the local anaesthetic should be working very well. And in addition to that, I don't have to use something called a tourniquet, which is a tight cuff that goes over the arm. It inflates a bit like a blood pressure cuff. It compresses the blood vessels and stops the blood flow. So injecting beforehand means that we don't need to use this, and I find that patients are more comfortable that way. In terms of the surgery itself then, the hand will be cleaned and prepped with a sterile solution to prevent infection. We will check, obviously, that the local anaesthetic is working well and that there's no pain or discomfort. About a 3 centimetre incision is made in the palm, and that will allow us to make our way down to the transverse carpal ligament. So that's the ligament that forms the roof of the carpal tunnel, and then we need to fully release that ligament, and then the idea being that that will release the pressure off the median nerve. In some cases, we have to make a slightly longer incision, particularly if the hand is very big, or we simply can't fully decompress that ligament. So sometimes there can be a small extension to that scar. Once we're happy the ligament is fully decompressed, we will often look at the nerve. I like to get an idea of what the nerve looks like. Does it look very compressed? Does it look very inflamed? Because that will give me a good idea of hopefully how successful the surgery will be. Following on from that then, the wound is closed. I tend to use stitches that have to come out in 2 weeks. That's just my preference. The patient will have then a small dressing and a bulkier dressing applied over it, and I tend to send my patients home in a sling with advice from some simple over-the-counter medications, so typically paracetamol and something like Nurofen, an anti-inflammatory, if the patient doesn't have any contraindications to using that.